Welcome to the Resilience Series. I'm Stephanie Weaver, the author of the Migraine Relief Plan and the upcoming Migraine Relief Plan Cookbook. And for that project, I'm interviewing a variety of people on the topic of resilience. My guest today is Dr. Susan Mathison. Dr. Mathison is board certified in 3 specialties: ENT, sleep, and integrative medicine. And she is the founder of Catalyst Medical Center and Spa in Fargo, North Dakota. Welcome, Dr. Mathison.
Thank you, Stephanie. It's great to be here.
So you see a lot of migraine patients in your practice as well as other conditions. Yet like all doctors, your time with people is limited. So how can patients best partner with their physicians to get the best possible care?
I think that is such a great way to approach it as a partnership. I often get people who have been to multiple other doctors before. They've been to the Mayo Clinic. They've been to the University of Minnesota. They've been to many other specialists in our local area. And so, I think it really is helpful if you, carry a little Word document, that kind of lists all, of course, all of your medications, all of your, past medical history, all of the previous, tests and imaging that you might have had. And just, the more organized you are, the more easily your physician can kind of consume that information. Just like all of us, when things are kind of thrown at us in bits and pieces, and it gets hard to process it all. And I think, just as you might be overwhelmed by your health concerns, sometimes your physicians get overwhelmed as well, and it's hard for them to take it all in. I think another thing is that don't expect a magic cure in one visit. I always tell people I wish I had a magic wand, but I don't. And, I wish I could, take their suffering away. But unfortunately, that's not often how it works. Sometimes there'll be some little glimmer of something that pops up, and it's like, oh, this is something that hasn't been explored. Let's talk about this. Maybe this is our answer. But I think, it works best when, we obviously both your physician and you have a vested interest in your health and happiness. But as the human body is a complex machine, with spirit and soul, and so sometimes it's like, if somebody doesn't give you all the answers in one visit, please don't be frustrated, because it can take some time and developing a relationship to help you best. So
That's great. I do have a Word document that I print out, and it has all my medications that I'm on, if I've tried anything new, the amount of exercise I'm getting, the
mhm.
yoga meditation that I do, and then I have the my last 4 months of migraine day experience, what I
Mhm.
took for those, and what I think was the trigger for that, and that allows my doctor just kind of at a glance to chart stuff and understand exactly kind of
Yeah,
where I'm at in the process. And every time I bring that into a new doctor, they're always like, "Oh my God, we wish all of our patients would do this." and
yeah,
and it's easier for me because I just keep it updated, and
yeah,
then I don't have to fill out. I just like when I have that long chart to fill out, I just like see attached, see attached, see attached, so I don't have to
yeah.
fill all that stuff out
Yeah,
for people.
that's great. Yeah. And someday we're going to have, you know, uh, things that are able to import, stuff from your Word document into your medical records. So, we're not quite there yet. There's still a lot of, inefficiencies in healthcare, and especially technologically, but we will get there, I know. So that's great. And I love also, Stephanie, how you touch on the lifestyle medicine that you do for yourself. um, you know uh, Actually, I I have stacks of your postcard in each room that gives like the information about your book, and I prescribe that even for a lot of my patients who don't have migraine, because I think it's such a good resource for, digging in. I think so many illnesses are caused by lifestyle factors, finding the diet that works for you, not necessarily the diet, but the foods that work best for you, because I truly do believe that food is medicine. And, and focusing on those healthcare practices that are like yoga and meditation and exercise that so many of us forget about. And I think, being boarded in integrative medicine too, most physicians I find are becoming more and more open to integrative therapies, but they just, it's like they have to focus on certain things, and you might have another provider who focuses on the other. But it's good for everybody to be on the same page and to, help be part of your team, cheering you on. But I do think that, each individual person, there's a lot of self-responsibility that goes on. I always talked about, it's not healthcare reform, it's self-care reform, that we really need to focus on. I love, referring people to, your diet suggestions, because, you give an entire list of things that can be triggers for people in so many different ways. And I tell them, it's like, it's kind of surprising, because sometimes even, healthy foods can unfortunately be triggers for certain people. And it's like, you have to find out, sorry, I have my little puppy, exploring down here.
You never have to apologize for a dog.
But finding out the foods that support you the best, and each person is different. As I said, even though your book and your recommendations are, migraine focused, there's just a wealth of health information and wellness information that I think can be helpful for anyone who's struggling with, an illness that has some mystery and isn't easily managed.
Well, thank you for that. And I did not know you were going to say that, but thank you very much. I'm just super grateful that physicians are finding it useful as a tool, because what I say in the book is, it's like, imagine I'm your private health coach, and I'm walking you through every week little changes that you can make with food, with lifestyle, that gradually over time, I mean, it's not a quick fix at all. And I don't ever say that it's going to cure anybody. Everybody's different, but there surely is something in the one or more of the lifestyle changes that may have an impact for people.
I totally agree.
Yeah. A lot of chronic illness folks that I've talked to on this series have had challenges with their physicians in the past, not believing them or not respecting them. So how can patients bring information to a visit and have it be well received by their doctor?
I think, if, first of all, I'm sorry, I'm so sorry that people end up feeling that way. But once again, if you can approach things with and I think sometimes people have been so disappointed in the past by interactions with providers that sometimes they almost approach the room with in a defensive manner. And so I think, just be defenses down, and hopefully, kind of your energy will speak to them. Be super friendly, be grateful, and just, it's like humor never helps or never hurts. Just say, I'm sure you were, it's like, I know I've got a stack here for you to absorb, and and just be clear. It's like, that you don't have expectations that they can solve your problem overnight, but just say, hey, I just wanted a fresh set of eyes, and to see if you have any other, any other ideas for me. And I'm, I think always, if you are respectful and, and grateful, most of the time that's going to be reflected back to you. If it isn't, that's super unfortunate, and I'm very sorry about that, but that isn't the provider for you. Sometimes you do catch people on a bad day, that certainly, there's a commercial, and I can't remember, exactly which company put it out, but it's like, I think actually Chick-fil-A put it out. It's like you're seated in a restaurant and there's a woman eating quietly, and, you don't know her story, that her husband just died. And so, give people a bit of grace. Maybe they were having a bad day. Maybe, maybe they have a very sick patient in the hospital. I was telling Stephanie before we started this recording that, my dad has been very, very sick and in the hospital this week. And, I think in 30 years of practicing medicine, I've only missed two, maybe 3 days of clinic. And I had to cancel Monday because I was up till 3 a.m. and I was so worried. I just had to do it. And, and I did surgery with, it's like, a few tears in my eyes, but it's like, I can, I can, usually I can function okay, but every once in a while there's, just know that sometimes there might be something going on that isn't at all related to you. But as I said, if you approach people with respect and gratitude and realizing that, chronic illness is, it's obviously it's devastating for the person who's struggling, but, it's like, it's hard for your physician too, when they, it's like, we're people pleasers and fixers. And, and when we can't do that, sometimes we're disappointed in ourselves, and we may, reflect that back to you in some degree. But I think if you approach it as a partnership, that, that this is going to be a series of visits and a series of exploring with some fresh eyes. And two, I sometimes have patients who say, oh, I've tried that. But when we really talk about it, they've given it kind of a short, it's like, I tried going gluten-free, didn't work. And then I find out it was for 2 weeks, so, so not only kind of like, be honest with what you've tried, and have you given it a good college try? It's like, have you really, I usually tell my patients when we're doing an elimination diet that, this is going to be, 3 months. And then we're going to add things back in very slowly and, individually. But, you got to give it, you got to give it an extended try, and, be very diligent with calendars and logs and such to really help figure out what might be that subtle little trigger that is affecting you.
Yeah, that's a great answer. I think one of the things I probably was guilty of in the past was landing on a doctor and thinking, oh, this person's going to have the answers, and going
Mhm.
in with this huge list of stuff that I wanted them to explain to me, and not, doing my job of prioritizing and saying, here's my top complaint. I'd love
Mhm.
to discuss that today and see what you think. And then if we have time, these other two things are really bothersome. And so, because I do know, I definitely, I've definitely been literally sitting in an exam room and hear on the other side of the door someone say to the doctor, well, she brought in a magazine article. And I just kind of sank, like, oh,
Yeah. Mhm.
that's how I'm going to be treated. Whereas if, now I would probably say, let me figure out what I think this doctor might be most helpful to do for me. I'm going to
Mhm.
focus just on that for this visit. I'm going to be super organized and bring that stuff in a way that they can
Mhm.
really digest quickly.
Mhm.
And then kind of see how it goes. And then definitely, like, I move on from providers that just don't feel like they're going to be a good partner for me.
Right. Right. Yeah. And two, when you've been to, I love that saying about it's like not expecting, you know, them to fix everything, and the prioritization, and and just, and setting out your expectations and just saying, I know I'm a complicated case, and I appreciate your time, and I just wanted that fresh set of eyes. Most of the time what I do is I don't have time during that visit allotment, but but some well organized records, I will have had time before I go in the room to go through like the bread and butter of a case. But if there's if it's 50 pages of records, I rarely will have had time to review all of those. But then in the evenings, and weekends, your doctors are still working for you and on your case, even after hours most of the time. And so, but then that's when I'll kind of like be okay, is there, it's like I'll reread everything, make sure my notes are complete, and then I might think, oh hey, I'm gonna put a note in for like, maybe there's one other test that I can think of, or maybe I'll add something. It's like, we're going to talk about this the next visit. And so just know that most docs, most providers are, as I said, they're people pleasers, and they do want to help, but figuring out how you can give them your information in an organized way, I think is really great.
Yeah, and just one last thing I'll say is that, my neurologist that I work with now, um, he would give me a medication. And if I came back and said that didn't work for me, he would not really necessarily listen to that. But if I come back in and say, I tried 14 doses and 13 times I saw no relief, then
Mm-hmm.
he was like, oh, that medication doesn't work for you. So it
Mm-hmm.
was kind of framing it in a way that he could register and say, okay, she did give it a full try.
Yep. Mm-hmm.
That's enough data for me to know this is not working and we need to try something different.
Yeah.
So that
Yeah.
was my learning, sort of how to do it in a way that helped him be a better doctor and partner for me.
Mm-hmm.
So my
Yeah,
next
that's
question
great.
is,
Yeah.
how do you define resilience?
Oh boy. And I love that you're doing a series on this. Um, I went through a really difficult personal crisis, a divorce about 4 years ago, and it brought me to my knees. I got married when I was 40. I had several miscarriages. I ended up being able to adopt my son when I was 44, and he was just, I'm the oldest of 7 children. So, um, being a mom had always been forefront on my mind, but it's like I wasn't, uh, you know, medicine sometimes makes it more challenging to have long-term relationships. And, but anyway, and I loved being a mom, but I was the breadwinner. I was the mom. I was, I did everything, and including having a busy practice. And so, we just got off sync with our communication, and it didn't end well. And, the thought of not having my child part of the time was just, it's so depressing for me that I really struggled. And I tried, I read books, and I tried supplements, and I tried exercise, and I finally had to take medication to kind of get me out of my very dark world. And I kind of say, it's like I couldn't see color. It was all black and gray. And but I got back my technicolor view, and I also realized that I had a little personal mantra, that I just, it's like when all I could do is focus on, taking that next breath or that next step. I happen to be Catholic, and there's this beautiful picture of Jesus with, basically, almost like a rainbow of sunshine beaming from his heart. And the title of that painting is called Jesus, I Trust in You. And that was my mantra. And so, just knowing that those valleys make you appreciate the peaks so much more. And, trying to focus on, just um, those little bits of, whether it's a cup of hot tea or, some tiny little self pleasures that can bring a little bit of joy into your life. And just know that, it's like in the darkest of times that, the sun rises again, and we will be better for our struggles and have more knowledge. And I found that, going through my own personal struggles made me, a better provider and a better communicator and a better partner too, because I've kind of, I did take lessons away from my role in our struggles. And um, um, yeah, I could kind of go on and on about what to do. Oh, and then I will kind of get back to one other little thing about, I do think that sometimes, actions, I think it's Tony Robbins who says, emotions follow motion. And so, taking those small steps, and also sometimes doing something for someone else, it kind of gets you out of your own head, and, in ways that you can be helpful. And I think that, gives something back to your heart that can be very helpful in your own healing. I know for you, Stephanie, your writing, I mean, it's like we met, about probably over 10 years ago. We met at a TED Med conference, and we happened to be seated next to each other, or a TEDx conference actually. And I think we went to the Big TED in Long Beach. And but I remember talking about your work, and and I as we kind of reconnected later on, about your migraines and vertigo, because since my specialty is ENT, otolaryngology, I definitely see patients with similar problems, and I'm sure that the work that you've put into developing these resources for others, certainly kind of helps you navigate some of the struggles you have with your health. And so I'm very grateful for the purpose that you've put behind your pain. It's like, you being able to help people through your own experiences, is definitely something that we all can do, to get us through hard spots, knowing that it will have you'll be able to help others by the insights that you've gained from going through your own struggles.
Thank you. Yeah, let me just respond to that a little bit. So yeah, meeting you was really great. And at the time I met you, I hadn't been diagnosed with migraine. I had no idea I was going to be going down this path or end up with vertigo. And when we reconnected, I had no idea that was your specialty. So it was all it all felt very beautiful and synchronous. But a couple of things I wanted to respond to. You mentioned your faith practice, and I think that's something a couple of speakers have talked about. And regardless of what those of you who are watching, what your faith practice is, I think that is a big part of resilience, having some kind of connection to a power greater than ourselves, however
Mhm.
that looks like in your
Yeah.
life.
Yeah.
And that's a beautiful way that you express that. So I wanted to thank you for sharing. I also wanted to thank you for being vulnerable. I think one of the things that I see has happened in the last couple of years is that the kind of facades have crumbled sort of generally across the board.
Mhm.
And so you see famous people who are now, spokespeople for, the Better Health app and mental health, and they talk
Mhm.
about their challenges, and it makes it okay. It makes it normalizes it. I was walking the other day, and I was doing a therapy appointment on the phone, walking, and I ran into someone I hadn't seen in a long time, and I said, "Oh my gosh, I can't stop because I'm talking to my therapist." And she kind of laughed and we waved at each other. And then I kept going. And my therapist said, "Thank you for normalizing therapy." And it
Mhm.
didn't occur to me that
Yeah.
wasn't what I was doing. I didn't say, "Oh, I'm going to normalize therapy in this
Right.
moment," because I don't find it. to be embarrassing to say I'm in therapy. And I've used antidepressants in the past, which I think is what you were referring to. So I think there's a lot of tools available to us. And what I think is very hopeful and helpful is that more and more people, including physicians, are talking about this and saying, like, yeah, it's okay to not be okay. That's Jamie Sanders, one of the migraine advocates, says that, and I think it's really
Yeah.
important for people to say that. So finally, you've talked a little bit about your self-care strategies and your definition. But let's talk a little bit about physician burnout, because you've kind of touched on
Mhm.
that. And I think it's something that's really important for people watching to be aware of. This has been a really unprecedented experience. And
Mhm.
North Dakota was a hot spot for quite a long time. And I've checked in with you a few times to see how you were
Mhm.
doing.
Yeah.
So tell us a little bit about your experience just as a physician, let's say in the last year, and the challenges that maybe people aren't aware of that have tested your resilience.
Yeah, I think um, physician burnout has been a topic for a very long time, and many people trace it back to the onset of electronic medical records, which were supposed to make our lives easier, but instead added hours of clerical work to the physician day. Um, and I still believe in electronic medical records. They're they're incredibly useful, but we still need to figure out ways of making that technology have a better user experience for physicians and for patients and for the rest of the healthcare team, nurses, um, therapists, the whole works. So, there's just, and I think women physicians struggle a little bit more because um, uh, it's like I mentioned, how much of my work gets done outside of normal office hours. Um, you know, just because that's just the way it is. There's just not enough time. I'm lucky I have my own private practice. And so I've been able to, structure, I make less money, but I'm able to have either a medical assistant or a nurse in the room with me, helping me scribe so that my record keeping is not quite so onerous. Um, I think this particular year I have not been, um, you know, I take call in an emergency room, and certainly I have to take precautions. I've worn the astronaut helmet doing surgery, etc. But I haven't been in the emergency room or the ICU, except as I got to stay briefly. I mentioned my dad was my dad had COVID and he was briefly intubated, and so I kind of got to experience it from a patient family perspective, and even I wasn't allowed to go back in, uh, after he got intubated, and they enforced the strict COVID protocols, and the nursing supervisor made sure that I was clear that included me. So, but once again, just realizing that your providers are human, and they have personal struggles as well as professional struggles, and that I think if we approach things as a mutually beneficial partnership, um, um, you know things are going to go better for both parties. I also think that you'd be amazed at um, how far a little bit of gratitude can go. Just maybe acknowledging your physician, um, not only during these times, but just just thanking them for helping be on your side, and those little bits of appreciation. It's like your physician would love to get your Christmas card. Your physician would love to um, you know get your baby announcement. Those little things that remind us that we're not just technical workers. Sometimes we have people come in with a list of, do this, do this, do this, and usually, it's like as I've gotten older, I've been able to manage that a lot more easily. It's like I don't I don't feel threatened by that. I will try to compliment people by being, advocates for their own health. So, magazine articles, if it's something I haven't heard about, I just say, wow, it's so great that there's so much information, and you're helping me, and maybe you're helping another patient because you're making me aware of something new. And if I do know about it, I'll give my opinion. I won't be disparaging, but I'll just say, hey, this has some good points. Some of the research is showing this, but let's keep exploring. So as I said, just everybody has their story that is behind that we attempt to have a professional facade, but sometimes our humanity breaks through. And the things we've talked about before, kind of being organized and prioritizing, and being grateful. And then too, the other thing is, because I care for my patients, sometimes it is hard for me to turn, to leave. And so sometimes it's hard for me to put a stop to an appointment. And so sometimes I do run a little bit late. And so, ways that you can help are that, being aware of your appointment slot, and just knowing that, if you're aware, sometimes you can help your doctor, turn it off a little bit, and know that, it's like, you can say, hey, can we set up a recheck in a month, and maybe go a little further into this topic, and also being gracious if they are running a bit late. It's not that we don't value your time. It's just that I get so present and in the moment that I sometimes lose track of time, just because, as I said, that's a problem for not being able to turn it off, but it's part of my personality, and just, giving us a little grace, and also maybe helping us when we know that there should be a time to stop to add it for the next session.
Great.
So.
Dr. Mathison, thank you again for being here today and sharing your thoughts. Learn more about her work at catalystmedicalcenter.com, and check out other episodes of the Resilient series on Facebook Watch, IGTV, and YouTube. Follow me at sweavermph if you're not following me already, to learn more about my upcoming book, The Migraine Relief Plan Cookbook, which is due out in spring 2022 from Surrey Books. Thanks so much for watching.